The patient reported experiencing dash after taking the new medication. So this is the question. Okay, so what is the missing information over here? The dash over here. The patient reported experiencing dash. Okay, and this is the consultation extract. Okay, this is the sentence. Well, the first few days were fine, but by the fourth day, I started feeling dizzy, really dizzy, and I couldn't keep my balance properly. So this is the consultation extract. This is the question. Okay, but my real question to you is, what type of information is most likely missing in the blank? Okay, I want you to tell me what, type in the chat box. Experiencing dash, is it going to be a name of a medication? Is it going to be a side effect? Is it going to be a symptom of a new condition? Or is it going to be a past diagnosis? So I want everyone to participate because this is testing your prediction skill. Okay, that is just by reading the question, you must be able to predict whether the answer is going to be a medication name, a side effect, a symptom, a new condition, or a diagnosis. Right. So we have everyone going with answer option B, that is a side effect. Okay. So let's see if that is indeed the right answer. Yes, the answer side effect is indeed the right answer. And more specifically, the word dizzy. Okay. The word dizzy signals a side effect from the medication. Now you see over here, even now see, if I hide the sentence also, like so if this sentence over here, this consultation extract is not there also, if I'm only showing you this sentence, you must be able to understand. The patient reported experiencing dash after taking the new medication. So what are the keywords over here? New medication. What is the linking word over here? So linking words are words that are associated to the answer. Okay, so the word experience and the word after are linking words. Right, these are all linking words over here. Linking words can also be keywords, and this is the keyword over here. Okay, so keyword is medication. Now the linking word is experiencing. So after taking a medication, what will a patient experience? Okay, now you can say your sense, okay, your brain will tell you it is going to be a side effect. Okay, so like this, you have to predict. So this prediction skill will help you to pinpoint the right answer. Okay, because why is this important? Because in the audio, okay, so how long does the consultation extract last? It lasts for 5 minutes. Okay, that is each consultation lasts for 5 minutes, that is 300 seconds. Okay, it lasts for 300 seconds. Now how many questions do we have? We have just 12 questions, right? And the answer, to say one, okay, let's give it 3 seconds. 3 seconds per question. Okay, so how much time are we talking about? So 12 multiplied by 3, I believe that is 36, right? So 36, okay, or approximately we can say 30 seconds, right? That is in a 300-second audio. In a 300-second audio, the answers we are looking for is only in 30 seconds. That means 270 seconds. The remaining 270 seconds are what? 200 seconds, 70 seconds are basically the audio which is not talking us to us regarding the answer. Okay, so you need to know there are useless information and there is useful information. The useless information is the 270 seconds. The useful information, that is the answer, is coming from the 30 seconds. So, and these answers can come anytime, anywhere. So you need to have a very sharp mind, a very, shrewd, sharp mind who is hunting. Okay, your brain is hunting for the right answer. And in order to hunt, you must know what to look out for. Okay, you need to know, okay, this is what I'm looking out for. This is what I'm waiting for. Okay, and if that clarity you have, and as soon as they say it, you will be able to write it down. Okay, so that prediction skill, that anticipation skill, you need to develop. Okay, so very good. Everyone has done a good job, right? So we have Priyanka who has joined as well. Good. All right. So good evening, Priyanka. Now let's go to the second question. Okay. So again, I want everyone's, prediction skill very, very sharp over here because this is very important for listening part A. Right. So let's come to the second question over here. Now, the second question, I think I will have to zoom out a little bit. Yeah. So this is the second question. I hope it is visible. The patient has been referred to the clinic due to dash. The patient has been referred to the clinic due to. And this is the consultation extract. So what type of information is most likely missing in the blank? Is it going to be a previous treatment, the duration, a diagnosis, or a reason for referral? So what are the keywords over here? Let's do the keyword analysis. The patient, the subject is a patient over here, has been referred to the clinic due to. Now, why would a patient be referred to a clinic? Right. So let's see. So we have multiple answer options over here. The patient has been referred to the clinic due to, right? So they write more appropriate answers. So there will be multiple answers that seems appropriate, but the more right answer would be a reason for referral. Okay. So over here, a reason for referral is basically, why the patient was actually referred to this particular clinic in the first place. So let's just read the consultation extract. Yeah, my GP wasn't too happy with the results of the last blood test. Okay, my general practitioner, he wasn't too happy with the results of the last blood test. That is, previously a blood test happened and the results were not very positive. She said my sugar levels are consistently above normal. Sugar levels are consistently above normals, and that I should see a specialist. And for that reason, I should see a specialist. Now, why has the patient been referred to the clinic over here? The patient has been referred. So referral means what? Another doctor. So only a doctor can refer a patient to another doctor. Okay. So why will a doctor refer a patient? The doctor will refer a patient if there is a strong reason for referral. Like for example, in OET writing, that you will be writing referral letters, right? So why do we write a referral letter? We write a referral letter because the patient needs specialist care from another person. That is the reason for writing this letter. Now see over here, a previous treatment. Can we say that I am referring the patient to this clinic because the patient underwent a treatment? No. Treatment is supposed to help the patient. Okay. Due to the patient was referred to a new clinic over here because the patient had okay, even you can see diagnosis also. Okay. Due to a diagnosis or a condition, that also you can say, but a reason for referral is a even more appropriate answer. Okay. So this is slightly tricky one over here. Now let's go to the third one. I think that would be a little bit. So that was a combination of an OET's writing answer as well. Right. So this is the main question over here. The main concern the patient raised was related to. Maybe I will just first block this up. Yeah. So just read the question over here. The extract I will show you later. Okay. That is, I want you to work on a prediction skill. The main concern the patient raised was related to. Raised means reported. Huh? The patient reported. Raise a concern, we'll say, right? So what is your prediction skill? What type of information is going to be in the missing blank? The main concern, right? So, yeah, right. So here, what is the keyword over here? Related to, okay, related to are the, linking words over here. The keyword is concern. The main means the major concern the patient reported. So, under what circumstance will a patient report a concern? Okay, when the patient is having some difficulties, okay, the patient has some difficulty doing something, okay, so that is when the patient, I have so many concerns. My number one concern is this, right? So, sleep disturbance, that is not being able to sleep peacefully, okay, that is a very likely reason. Now, type of medication, no, I don't think so. Family history, onset of illness, not entirely correct over here. So, what's the answer of everyone has written? Right. So, everyone has chosen answer option A. Right. So, sleep disturbance now wakes me up. See, this is the consultation extract as well. It's not just the pain, doctor. It's that it gets worse at night and wakes me up. I haven't slept properly in over a week. Okay, so first you have to read the question. Okay, so once you read the question, you must say, okay, the patient is saying a concern. Okay, and the concern is related to some kind of a difficulty. The patient is having some kind of difficulty. That's what the patient is reporting. Right. So you must say, okay, there is some concern over here. So I have to, the answer is going to be some difficulty. Now, when you, with that knowledge, when you're listening to the audio, the audio is saying, see, it's not just the pain, it's that it gets worse at night and wakes me up. I haven't slept properly in over a week. So it is related to sleep disturbance. So again, the prediction skill comes over there. Right. So again, these are a little bit difficult, I know, compared to the previous questions that we do. But when it comes to testing your prediction skill, I did not have any other way to actually, draft a multiple choice question. The only way I could make it was like this, right? So let's have the fourth question over here. So first, read the question. I'll just write this up. Now, what's the question over here? The patient began experiencing, so started experiencing symptoms approximately days ago. So what is the prediction skill over here? What is your mind telling you? What could be the answer? So going to a dose, name of a colleague, duration, or a treatment option. Okay, very good. Just by reading the question, you must be able to say, this is what I'm waiting for. The patient began experiencing symptoms approximately dash ago. So they're talking about what? A timeline. They're talking about a duration. Right. Very nice. Right. So they just by reading the question. Now you see, did I show you the extract? Did I show you that did you listen to the audio? No, without even listening to the audio, without even reading the extract, your mind is telling you, okay, I have read the question and my prediction skill is I predict the answer to be, few days. Okay. The patient started experiencing the symptoms approximately dash ago. So they're talking about a timeline over here, maybe 1 week ago, maybe 3 weeks ago, maybe 6 months ago, right? So duration. So your mind is telling you duration. So as I told you, it's a 5 minute length audio, 300 seconds audio. In those 300 seconds, only 30 seconds the answer coming. The 270 seconds are useless information. So you must be able to discard the useless information. So when you're listening to the audio, your mind should tell you, okay, I want only the duration. I want only to see how long it has been since the symptoms started. So here it is specific, time period they're saying. So with that focus, if you're listening to the answer, as soon as they mention it, you'll be able to write it down. So you see, you can this like this, you can discard the useless information. That is the pointless information that is not going to help you out. You can discard it. Right. So now see, I think it was just after I got back from the work trip. Okay, now in the audio they're saying, I got back. That is, I returned from the work trip, maybe a week or 10 days ago. Right. So what will be the answer? About a week. Okay, that is a week or 10 days. So that is the answer. Okay, like this. Now let's come to the very last question over here. And then we will practice with the listening part question, part A question, right? So this is the fifth question over here. Mm, Yep. Right. So what's the question? The prescribed treatment includes. So what is the answer going to be? What is the prediction skill telling you? You have not read the audio. You have not listened to the audio. You have not read the extract. Only the question you have read, right? The prescribed treatment. So here the doctor is giving a prescription. Okay. The treatment has been prescribed. Okay. And it's a prescription. What will a prescription include? A prescription will only include medication name and usage, right? So in the audio, they will talk about a diagnosis. In the audio, they will talk about a side effect. In the audio, they will talk about family medical history. But your mind is telling you all that information is useless information. Okay, for me diagnosis is not important, side effect is not important, medical history of a family is not important. For me what's important, the medication name is important. So with that focus, if you're able to anticipate for the right answer, you can discard the useless information and very attentively pinpoint the right answer. Right, so here she gave me these tablets. I think it's called amlodipine, 1 day in the morning for blood pressure. Right. So this is what prediction skill is. And this is the most important skill that you need to have in listening part A. Along with there are several other skills as well. That is, keyword analysis, comprehension, retention, detection, intuition. You really have to trust your instincts as well. And as I always say, you have to be able to understand the emotions of the speaker. Okay, so in yesterday's class we talked about emotive words, right? Contrast phrases and all that. So you must be able to understand the emotions of the speaker, the attitude of the speaker, the perspective of the speaker. So that skill is also going to help you out. So it's a combination of several factors over here. And more importantly, you need to have good multitasking skill as well. So what is multitasking skill? Your ability to do multiple things at the same time, right? So that is, you have to read the questions the same time, you have to listen to the audio the same time, you have to write down the correct answers. So see, you're doing multiple things at the same time, and that is what we call as multitasking skill. Right. So today, which listening shall we do today? So the app already has all the most of these. So among here, except for Dominic and Haley Doe, I have made all the other listening, recorded lectures. These are actually, this is a very latest material, so that's why I couldn't finish it off. Hope to do it anytime soon. Right. So how about we take mm, raise hands. How about Priyanka can choose today because Priyanka's exam is coming. So Priyanka, you can unmute yourself and you can choose one particular listening from here. That is other than Dominic and other than Haley. Do you have any particular listening document that you want to choose? We can discuss that today. Priyanka, you can unmute yourself. Yeah.
Andrew Taylor.
Andrew Taylor. All right, fine. So let's
Yes.
take Andrew Taylor. So there will be two extracts over here, right? So we're going to randomly, we will not be doing all the 12 questions. Okay, just random questions only we'll be doing. Maybe like maybe 6 or 7 questions we will do in a random order, right? So this is Andrew Taylor. So okay, so we have two extracts over here. First is Andrew Taylor reports frequent dash, most recently dash has become a problem. Okay, so we'll do extract two of Andrew Taylor. So question number 13 to 24, we'll do random questions from that. And we need the audio as well. Part A, extract 2. Okay, so everyone get your prediction skill, anticipation skill, keyword analysis ready. Think very clearly. Do not put yourself in high stress mode, because stress, anxiety, nervousness, okay, these are all not going to help you in any way. Okay, it is very important that you have faith in yourself. It is very important that you believe in yourself. And it is very important that you understand that the OET is a very cunning examination. Okay, maybe the first one or two questions itself will be very, very difficult. Okay, and the remaining questions will be easy. So if the first one or two questions are very, very difficult, what will a student think? They will think, oh my God, the first two questions are very difficult. Now there is no way I'm going to pass the OET, right? So they want you to think like that. Okay, or you make a mistake also. They want you to doubt yourself and distract you from the question paper and the audio. So don't fall for the traps of OET. Okay, it's a very brilliant examination. You really have to understand the brilliance behind it as well. So you also have to be very sharp. You also have to be very cunning. Okay, that cunningness from you is also very much important. Cunningness in a good way, not in a fraudulent way. Right. So, yeah. Now, what I'm going to do is first you will be reading the question, and I will be sharing you the audio as well. So these are all the audios. Yeah. Okay, just give me a second. Okay, so first let's do the 13th question over here. So first I want you all to read the question on your own, and then after that I will play you the audio. So read the 13th question. You can read the instruction. So you hear a hospital neurologist. Okay, so we are listening to a hospital neurologist over here talking to a new patient called Kathy Tanner. So a neurologist and a patient. Okay. And the patient's name is Kathy Tanner. Here they're talking about background condition, background to the condition, background information over here. That means history, past tense. Okay. So past information is coming over here, not future tense, not present tense. Okay. So read the 13th question. Okay. So I hope you have read the 13th question. I'm going to play you the audio. So listen very carefully and type the answer in the chat box. Now let's listen to the audio script and let's see what the answer is.
Hello, Mrs. Tanner. Pleased to meet you. Hello. Do you mind if we start off by getting some background to your condition? Just in your own words, could you talk me through the reason you're here and how it all started?
Oh, please call me Kathy.
Right.
So, until 2 years ago, my husband was in the army.
Right.
We lived off base, and I had a job which involved a lot of driving.
Mm-hmm.
And whenever I was in the car, I noticed that my neck would get pretty stiff at times.
Right.
It was hard to turn my head. To cut a long story short, when my husband left the army, we moved to a new house.
Okay. So the answer is already done with. Okay. So those who found the answer, they can type it in the chat box. Those who could not find the answer, no worries. Okay. It takes some time. So here, what we are going to do is we are going to talk about the three methods that comes under the practice of listening. So obviously the questions are important, right? So first and foremost, simply reading the question is not going to be sufficient. You have to understand the question. You have to comprehend the question. So comprehension of the question basically means understanding the question, right? And to understand the question, you need to do the keyword analysis. Okay. The keyword analysis is very important. And along with the keyword analysis, okay, you also have to give importance to the linking words. Right? Keywords are important. Linking words are also important. Linking word can also become a keyword. Okay. And once you have understood the question, then you must remember the question. You must not forget it. Understanding the question after a lot of hard work and then forgetting the question is useless. So you have to register that information to your memory. Okay, you must register that information to your memory. And then when the audio is playing, your eyesight, okay, that is your eyesight over here should only be in the 13th question. Okay, when the audio is playing, don't unnecessarily read the 14th, 15th questions and all. Okay, you're waiting for the 13th question. So therefore, your full concentration should be in question number 13. Okay, and then once you have predicted the answer, and once you have written the answer without any spelling mistakes, then you have to go to the 14th question. Right. So let's comprehend the question doing the keyword analysis. Right. So let's take a look into the keywords over here. Background to the condition. The patient, that is Kathy Tanner, she experienced discomfort and a dash. Okay, so what is the question, the answer going to be? It is going to be an experience. Okay, so it is a feeling. Okay, see, we can only experience a feeling over here. Right, she experienced discomfort, and so along with discomfort, combination. So buy one, get one free. Okay, so she got discomfort, and along with that, she got another experience. So the answer is going to be an experience. So the key word over here is experience. And what is the linking word over here? Feeling. Okay, so this experience over here, it is a feeling. And where is the feeling happening? In the neck. Okay, so you know that the patient is having some kind of a discomfort, some kind of a problem in the neck. So you have to say, okay, my duty here is to find out what distressing thing she was feeling in the neck. Okay, so and that too whilst driving. Okay, whilst means during. Okay, see, give importance to the words WHILST. Whilst, those who do not know the meaning of whilst, it is called during. Okay, so during driving. So while she was driving, during driving, she had some kind of a problem in her neck. So the answer is a problematic neck. So what problem did she feel? So like this, you have to anticipate. And they are going to talk about a lot of nonsense there. Okay, there is no need for you to give any importance to that. But as soon as you hear the right answer, you must be able to pinpoint it and write it down. So how many of you? Okay, so we have, right. Okay, so everyone has written the word stiff over here. So let's see if that is indeed the right answer. Okay, so the audio script, we'll just keep it right there. Let's take the audio once again. Yeah. Now see, this is the prediction skill that you need to work on. Now see over here, there's a lot of useless information. They are not directly beginning with the answer. A lot of useless information is coming. Now let's listen to the audio script and let's see what the answer is.
Hello, Mrs. Tanner. Pleased to meet you.
Hello.
Do you mind if we start off by getting some background to your condition? Just in your own words, could you talk me through the reason you're here and how it all started?
Please call me Kathy.
Right.
So, until 2 years ago, my husband was in the army.
Right.
We lived off base, and I had a job which involved a lot of driving.
Mm-hmm.
But whenever I was in the car, I noticed that my neck would get pretty stiff at times.
Right.
It was hard to turn my head.
Now you see over here, they have told you pretty stiff. Pretty stiff means very stiff. Now, if you write stiff, but if you write pretty stiff, you will not be getting full marks. Because if you write pretty stiff over here, do you think it will become a meaningful sentence? Experience discomfort and a pretty stiff feeling. Okay, and a stiff feeling, it is a grammatically accurate sentence. It is a formal professional sentence. And a pretty stiff feeling, it is not a grammatically accurate sentence. So sometimes you have to give importance to the grammatical accuracy. Okay, so finding the correct answer and also making sure that you're writing it without any spelling mistakes, and at the same time writing it in such that it does not make a incorrect sentence. That is also very important. Okay. So now over here in the audio script, you hear this word driving. Okay. So in the audio script, when we listen to the audio script over here, now you see there's a lot of useless information. Hello, Mrs. Tanner, pleased to meet you. Hello, do you mind if you're telling me some background information? Okay, could you tell me the reason you're here and how it started? Now she's please call me Kathy. 2 years ago, my husband was in the army. We actually lived off base. Off base means away from the base. And I had a job which involved a lot of driving. Now, when you hear the word driving, you should become alert. Why should you become alert, extra alert when you hear the word driving? Because this is the key word, right? The key word in the question is basically this particular sentence. Where is it? Right? Driving. So when you hear the word driving, you should become alert. Okay. And now you have to wait for the next word over there. That is neck. Some feeling in the neck over here. Okay. And now he's going to say whenever, again, this is past tense. Okay. Background information. So the audio will also be in the past. Whenever I was in the car, I noticed that my neck, as soon as you hear the word neck, you should become alert. Okay. Now the answer is getting nearer. My neck would get pretty stiff at times. So she had a very rigid neck. Stiff means what? Very rigid, not flexible. Opposite of flexible is what we call as stiff and very rigid. Okay, so this is the stiff feeling, a very rigid feeling she was experiencing. Okay, and it was hard. Because of that, it was hard to turn my head and nothing else matters. So we'll be writing the word stiff as the right answer. Okay, now let's come to the 14th question over here. Okay, so I'm going to give you some time to read the 14th question. And first you have to do it on your own, and then let's see if you're able to find. Okay, so on the app, I will be, see again, visualizing. Okay, so as you can see over here, your ability to visualize, okay, with stiff neck, that visualization strategy will definitely help you out. Now you see over here, we talked about stiff neck. But when I show you this image over here, this is going to be more stronger in your memory. So in the previous class, I told you, right? If you read a novel, but if you see a movie, which is going to be strongly imprinted in your memory, the movie, the visual aspect is going to be much more stronger, right? So try to boost your imagination up. So when you're listening to the audio or when you're reading the question, okay, see driving. So the patient is driving, okay, and during driving, she's experiencing a feeling. So imagine the patient driving a car, okay, and so that imagination, that visualization skill will definitely help you out. Beginning, it is tough, but bring in that visualization ability, slow and steady, we'll be able to get it out. Right. So now let's go to the 14th question. Right. So read the 14th question now. First, you do it on your own. Okay. So I'm going to play the audio now. The audio script and try to find out what the patient used to relieve symptoms in the patient's neck.
Right.
He tried to fix the problem by a neck adjustment, but actually it just made things worse.
Oh, dear.
I found I was losing flexibility in my neck. I began to use a heat pad, which did help at first.
Good, but was not for long.
No.
All right. So see, what did the patient use? So what's the answer? Okay, so over here, what is the linking word as well as the keyword? The linking word and the keyword is basically the word used. Now, what is the answer going to be? A product. Okay, we can only use a product over here. Okay, used a particular product. And what was the purpose? To relieve symptoms in the neck. Okay, so the patient has certain neck problems. Okay, and to alleviate the symptoms, to get relief from the symptoms, the patient used a product. So here your mind should tell you, okay, the patient was having some neck issues, and to get some relief from that, she used something. So what was that thing? That is what I need to find out. So when you're listening to the audio, you have to attentively wait for the relief she got by using a particular product. Right. So let's take a look into the audio script over here. Now, what is the audio script saying? Okay, so before that, what is the meaning of exacerbated? Type it in the chat box. What is the meaning of exacerbated? You have to know the vocabulary. Exacerbated basically means, yeah, elevated is a good word. Not entirely, increased. Okay, that is worsened. Okay, that is worsening. That is a condition or a diagnosis becoming more worse or becoming more aggravated. Okay, that is what we call as exacerbation. Okay, so that is very good. Okay, so these are small clues. Okay, that is the answer is going to come over here as soon as they finish talking about this. So the OET is helping you. Okay, the reason why they give you some in-between information over here is to give you some rest. Okay, so you'll get at least 5 to 10 seconds rest over here. That is immediately from the 13th question, they're not going to jump to the 14th question. Okay, so to give you some rest, to give you some relaxation, that is okay. This you don't need to give too much importance. Okay, so don't focus too much there, don't waste too much energy. But here you have to invest your energy, right? For that reason, they give you some tips, some helping points like that. Now let's take a look into the audio script over here. Where is the audio script? Yeah, as you can see over here, it made things worse. Okay, so he tried to fix my problem by a neck adjustment. Now see, the word over here, the used dash to relieve symptoms in the neck. Okay, so here the patient is telling, I went to an osteopath, decided to visit an osteopath, and he tried to fix the problem by a neck adjustment, but actually it made things worse. So that is the thing over here. Osteopathy exacerbated the problem. Now he is empathizing, and now the Kathy is saying, I found I was losing flexibility in my neck. Okay, no more flexibility. I began to use a heat pad. Okay, so it is a heat pad which did help. Now see, it did help. That is, it did give some relief to the patient. The neck. Now see, the keyword is over here. Okay, so Rina has written heat pads over there. No problem. You still will be getting marks. Okay, so one extra S over there does not mean that you did not listen actively. So then this is a listening test. So the OET wants listening skills from you. Okay, not your writing skills over here. So here your listening skills. So you listened to you read the question, you understood the question, and you listened very attentively, and you wrote heat pads. Okay, so no problem. That one extra is there. You may not get full marks, but still you will be getting marks for it. Okay, so no, OET is very lenient. Okay, so that is the reason why everyone is choosing OET over IELTS. But there are certain things we still have to try to make sure we do everything correctly. Okay, so let's just listen to the audio just once more so that you're able to understand that why heat pads is the right answer. Symptoms in the patient's neck.
Right.
He tried to fix the problem by a neck adjustment, but actually it just made things worse.
Oh dear.
I found I was losing flexibility in my neck. I began to use a heat pad, which did help at first.
Good, but was not for long.
No.
All right. Okay, so that is the answer. Now, how about we take some random questions from here, further developments and conditions. So this is all. Okay, so let's do certain prediction skill over here. Now, what is the 15th answer over here? Okay, doctor recommended. So what will a doctor recommend? Okay, the doctor will usually recommend, certain disease, not disease, like what do you call it? Yeah, medications are prescribed. Doctors prescribe medications or administer. Okay, if the word is administer, then it is medications. Okay, or if it is prescribed, then it is a medication. So it is a recommendation. Recommendation basically means an advice. Okay, so here maybe doctor recommended some kind of, morning walk, evening walk, some kind of physical activity. Okay, so like that. Okay, so giving importance to the words is very important. Now 16th question, the condition described as. Okay, yeah, okay, yeah, physiotherapy, yeah, that could be a recommendation, right? Now the 16th question over here. Okay, so maybe we'll do the 16th question. So let's do the 16th question over here. So we'll just do random questions. No need to go everything in one single stretch. Right. Physiotherapy. Okay, so let's take a look into the 16th question. Okay, so read the 16th question now. Condition, diagnosis of spasmodic torticollis. Condition described as. So here, what is the key word? Description. An adjective is going to come, right? The answer is going to be an adjective. So what is an adjective? An adjective is something that describes a noun. Noun, verbs, adjectives, you have to know that. The answer is going to be an adjective. Condition described as. So this is the noun over here. And this is the adverb. As, right? So let's listen to the audio now. Condition being described. So let's hear the audio now.
And one day, the head of the clinic looked at me while the therapist was trying to position my neck and whatever. And he said, "You know what your problem is, don't you?" And I replied that I didn't. And he told me that I had spasmodic torticollis. And I had no idea what that was.
So what happened then?
So he says, "Oh, it's untreatable. You just have to learn to live with it." I went home in pain, feeling depressed and hopeless.
Yes, of course.
All right. So were you able to pinpoint the answer? How is the doctor? So here the answer is actually coming from the patient only. The patient is telling she was diagnosed with spasmodic torticollis, and the doctor described the condition. How did the doctor describe the condition?
Untreatable.
Yeah, very good. Right? The answer is untreatable over here. Okay, so as you can see over here, let's see. Right, so he's saying, so I started going in for regularly for treatments, and one day the head of the clinic, that is the owner of the clinic, looked at me while the therapist was trying to position my neck and whatever, and he said, "You know what your problem is, don't you?" And I said that I didn't, and he told me that I had spasmodic torticollis, and I had no idea what that was. The neurologist asked what happened then, so he says, "Oh, it's untreatable. You just have to learn to live with it." Learn to live with it means what? For the rest of your life, you have to live with it, and you better start learning to live with it now, because it is never going to go away. It is always going to be there. Okay, so this is the description. Okay, he's describing the condition as a thing that is going to persist forever, as if it is untreatable. And then because of that, she was feeling very hopeless and very depressed. Right, so once again, I'll just play the audio just to get a little bit more thoroughness over there. In the condition, how is the condition being described? So let's hear the audio now.
And one day, the head of the clinic looked at me while the therapist was trying to position my neck and whatever. And he said, "You know what your problem is, don't you?" And I replied that I didn't. And he told me that I had spasmodic torticollis. And I had no idea what that was.
So what happened then?
So he says, "Oh, it's untreatable. You just have to learn to live with it." I went home in pain, feeling depressed and hopeless.
Yes, of course.
Now see over here, when it comes to this one, it is not very easy, because you need to know what it and all is. Because OET people, they actually like to use a lot of its. Now see over here, how many its can you locate over here in just one single statement? Okay, will make difference. Now see over here also, the patient is saying, is there any other pulse over here? Yeah, see, it. All right, so I say with the word it over here. Mentioned is there any other it's? Live with it. No. Yeah, this is the thing I'm looking for. All right, so here this is the thing that we read. So here, how many it's you can see? I can no longer, he said, what a problem is when I don't know. He told me that I had possible, no idea what happened then. Yeah, as you can see over here, it's, you just have to learn to live with it. Now see over here, this is a very common word. See, it's repeating too much. Okay, it. Again, there are several other words also. Now, you have to know what this it is referring to. Okay, so for each and every it over here, it is basically referring to one particular information. And if the student is not able to connect the it to that information, they're really going to, struggle over there. So here in this answer that we just did, okay, that is it's untreatable. So if they want, they can say spasmodic torticollis is untreatable. Okay, but instead of saying that is your condition, that is spasmodic torticollis, is see that. Okay, now what is that over here? That over here is also referring to spasmodic torticollis. Okay, so that and this it, okay, and this it, everything is related to this one particular condition. So you have to train yourself to understand what each and every it and that and all refers to. So they will never say, oh, your condition is untreatable or spasmodic torticollis is untreatable. They say, oh, it is untreatable. You just have to learn to live with it. Okay, so like that. Okay, now see, I'm sorry to hear this. So what does the word this refer to? This refers to that she was feeling depressed and hopeless. Now see over here, the word this refers to the patient feeling depressed and hopeless. So this connection, your ability to connect the words it and all, I think it's called prepositions and all articles, yeah, articles and prepositions are in the English language. You have to like make the connections over there. So if you're having some difficulty in this particular regard, then train yourself in this on this particular thing. Take one small step at a time and perfect yourself, train yourself, and then move on to the next strategy. Okay, so let's go to another question over here. Some months of bought something. Okay, so maybe the 19th question. 18th is very easy, right? So what's the answer going to the 18th question? Prescribed dash. So what's the answer going to be? It is going to be definitely a medication name, right? So there is no need for you to take any stress. Okay, so it is an antispasmodic medication. So you just have to listen very carefully to the name of the medication. Now, some months of. Okay, so some months of what? Now see, treatment history at home. So patient was at home and she was receiving treatment. So some months of a treatment. So in again, it's going to be past tense, right? So for few months, minimum 1 or 2 months, minimum 2 months, she was undergoing a treatment. Okay, so the answer is going to be a treatment. So like this, you have to predict, you have to anticipate. Okay, and all the other information you need to discard. Now see, let's come to the 19th question over here. She bought something. Now, what will we buy? It will be a product, right? She bought something to provide extra effort, support. So what is the linking word over here? The linking word over here is bought. She purchased. So you have to give importance to synonyms also. That is, when you read a question, you must be able to understand that you must be able to, that self-awareness you need to have. That is, they are not going to repeat the same words here and in the audio. In the audio, they will be saying different synonyms. Here, they're going to say different words. Okay, so the word bought may not be repeated there. Maybe in the audio, they will say purchased. So do not expect for the same answer to keep repeating. Okay, that is why comprehension is important. You have to understand. Okay, you have to understand the meaning. So even if they're using synonyms, even if they're talking in paraphrases, that is same information, but in different sentences, you still will be able to understand the information. So let's take a look into the 19th question. So let's see if you're able to do the 19th answer this time correctly. Now see over here the word purchase. Now see like this you have to visualize. That's why the entire recorded lectures in the app I have made it like this, so it is more interesting, it is more fun, and you really enjoy the process. Right. So let's take a look. Okay. So bought dash to provide extra support. So these are the key words over here. So for extra, so the reason for buying that is to get extra support. Okay. So I'm going to play the audio now. Support to the patient. So let's see what the patient bought that provided extra support.
The one really good thing I did at that time was to join a support group for spasmodic torticollis patients. So at least I knew I wasn't alone with the condition. But mostly I just sat at home a lot. In order to get a bit of pain relief, I got myself an orthopedic chair, and that did give me some support.
Right.
In November, I saw something in a magazine in the medical section. It mentioned some new treatments being done at the university hospital to treat things like spasmodic torticollis with Botox. We mentioned this to our GP, got a referral, and in December, I had the first injection in my neck.
Okay. So the question was what? The patient. What's the answer? What did the patient buy for extra support? No. Brought means what? B-R-O-U-G-H-T.
Bought.
No. Brought is what? What is the meaning of brought? B-O. This is quite basic.
Audio script, it is looking like a brought.
Audio script is looking like brought, is it? 1 second. Okay, so what is the difference between bought and brought? First, let's clarify that. Brought is basically, maybe it could be a typing error. I did not give importance to the audio script. So let's just listen to the audio script once again. I got myself.
Says I got an orthopedic chair, sir.
Yeah, I got myself means like I purchased, like I got myself.
Then that if it was a purchased thing, then there must not be R in the word.
R.
Yep.
You mean this
Brought is
one?
something you bring something for yourself, sir. If it is bought, like without R, it is something we buy.
I'm not able to understand your point over here. Let's take a look into the audio script. Actually, I did not give importance to the audio script this time. I'm reading something else. Okay, so let's just clarify it. Okay, so how the treatment go? My head almost turned. Devastated, spasmodic torticollis. Okay. So Kathy is saying, anyway, the one really good thing I did at that time was to join a support group. Okay, so she joined a support group for spasmodic torticollis patients. So she joined a community. Okay, that is, help, some kind of a self-help group and all. So at least I knew I wasn't alone with the condition. So she wasn't alone with the condition. She met other people who had the condition. But mostly I just sat at home. Okay, so she just sat at home. Okay, in order to get a bit of pain relief. Now see over here, in order to get a bit of pain relief, I got myself an orthopedic chair. Right. And that did not, basically means what? So this is what you said, This is the that you referred to, Salome?
No, sir.
Then
We are not referring to the we are saying she got herself. That means she has brought for herself. Something,
okay.
the orthopedic chair she has brought for herself, not bought.
Array. Wait, let's talk about, so what is bought? What is the tense over here? That is past tense. Okay, bought is past
Brought
tense.
means like she brought.
Wait. Cool down. Bought or past tense over here? Okay, what is the present tense of bought? Tell me.
Bring and buy.
Yeah, bring and buy. Yeah. So bring is the present tense, right? And what is the bring and buy is the present tense. Now, in order to bring something, there has to be location 1 and location 2. bring the plates from the kitchen to the dining room. Bring the
I brought.
bring the
brought the
so I brought the plates from the kitchen to the dining room. So if it is bringing, okay, so bringing basically means there is location 1 and there is location 2. So here, where is the location 1? So here they are only talking about home. I mostly sat at home. She was not going anywhere else. She was always at home only. Okay, in order to get a bit of relief, I got myself. So is she saying that she
She
went
has got
outside?
something for herself. Yeah, she has got
Yeah,
something
so
for herself.
yeah, so it is bought. No, and why is there a confusion for over here? Bought means I got myself an iPhone. So does that mean I went to China? I went to the China iPhone factory and I brought myself an iPhone from there. I got myself
No,
an iPhone. So it's purchase, right?
confusion is from the audio script. It is written, the word
Hmm.
brought is written over there in the audio script. That is the confusion. But not in the she is saying that I got myself. She is not using the word either bring or brought.
Hmm. Yeah, I got means I purchased. No, she purchased. I got myself an iPhone. What is the meaning of I got myself an iPhone? I purchased myself an iPhone, right?
Yeah, that could be.
See, brought means bring. Okay, see, what is the present tense of brought over here? Bring. So if it is brought over here, then she will tell, I brought the chair to my home from the supermarket. Okay, I brought it. So where is location? Location number 1 only is mentioned. Location number 2 is not mentioned over here. Right. So it is bought. So it is purchased. Okay. So she got herself. An orthopedic chair. So see, I got myself an haircut. So I went and I got myself a haircut. What means what? I actually went to the barber and I paid the barber for a haircut. So the word got. So you have got is basically, getting, spending money and getting that. So, okay, I'm not really sure.
Exactly, sir.
Mm,
What you have said is
mm,
absolutely right. But
mm.
is it the spelling mistake, or is it exactly what has to
Arey,
be there
there
in the?
is no spelling mistake. It is bought. She purchased. She purchased an orthopedic chair to provide extra
But the
support.
print, what I got, I just had a R in it
You had a
in the
printout.
official. Yeah, I had a printout.
Then I'm not so sure. This is the official printout. Maybe that printout is having a typing error. If that is having a typing error, what can I do? Okay. Uh,
How? Anyway, it's fine.
Yeah, that is okay. So it is broad. Okay, so yeah, that means the print that you got yourself is not correct. So this is bought over here. You're right. So even it is brought or even it is bought, basically the same thing. The answer is orthopedic chair. Okay, so did anyone get that correct? Yeah, so that is right.
I got it right, sir.
Yeah. All right. So now let's go to a tough question now. So actually, this was an easy question. Maybe let's take a tough question over here. So where the going to be a little bit different. Supplemented by is easy. Experience confusion is easy. So let's do the prediction skill. Supplemented by, what's the answer going to be? It is going to be a medication, right? Supplemented by vitamin A, vitamin B, vitamin C. So it is going to be a supplement like ORS, right? Experience confusion. So here it is going to be some kind of a distressing symptom. Confusion along with a distressing symptom. Analgesic relief, morphine self-administered via. So the patient was given morphine and it was self-administered, means she herself gave herself morphine via. So what is the answer going to be? Intramuscular, maybe intravenous, maybe subcutaneous. Via basically means what? The route of administration. See, we are not even listening to the audio. Even without listening to the audio, we are able to, suspect what the answer is going to be. Okay, side effects. Okay, so this one is a little bit not that easy. Side effects included difficulties. So what is the answer going to be? Even before, type in the chat box, what is the answer to the 21st question? What are you supposed to predict? What is the answer? What could be the answer? What are you on the lookout for? Side effects included. What is the answer going to be? Is it going to be a name of a medication? Is it going to be a side effect? Is it going to be
Name of the side effect.
no? How can it be a side effect?
Side effect including difficulty in breathing or
Difficulty
digestion,
swallowing.
swallowing. मतलब
Side effects. Side effects basically means it is again, side effect is basically like, see, what is abdomen pain? That is a side effect. Okay. What else? Sedation is a side effect. Sedation. Okay, that is what the patient feels is what we call as a side effect. Sedation is a side effect. Okay, abdomen pain, cramps, vomiting, nausea, diarrhea. These are what we call side effects. Swallowing, how can it be a side effect? That is an
difficulty in
activity.
swallowing.
I know, yeah,
Difficulty in
but
swallowing.
yes,
Difficulty in
so
swallowing can be a side effect.
the answer is not a side effect. The answer is an activity in which she is facing difficulty. Right. It is not a side effect. So here my question to you was, what are you going to predict? In the audio, they will say several side effects, but that's the reason why I chose the 21st question. Right. So the question's answer is going to not be a side effect over here. The answer is going to be a difficulty, an activity. Okay. Any type of activity, she's finding it difficult to do because of this particular side effect. Right. So it is going to be an activity. So difficulties in walking, side effects included difficulties in walking. So walking is an activity. It is not a side effect. Okay. So that is the answer. The prediction skill. So I want you to predict an activity over here, not a side effect. Okay. So may difficulties in walking or difficulty waking up early. Okay. Or difficulties having a clear vision, right? Difficulty having an appetite. Okay. So like that, an activity is the answer, not a side effect. So that's the intentionally I chose the answer option, 21st answer. All right, so let's do okay, this is how the OET can be very cunning over here. There is a lot of trickery behind it. You have to be very sharp. So let's take the 21st question. Okay, so difficulties included. Okay, side effects included difficulties. So in what activity was she having difficulty? See what difficulties the patient experienced as a result of side effects precipitated by the medicine. So let's hear the audio.
It did give me a few problems, like problems swallowing, but that was okay. I thought I'd received a miracle cure. I was devastated when everything started to come back like before, and I went back to the hospital in May.
All right, so just by listening up. Okay, so I think the answer came even before I showed, yeah, swallowing.
Yeah, swallowing. Yeah.
Yeah, listening and all. Brought is something we buy. Yeah, heartburn. Heartburn is not basically.
No, sir, swallowing भी बोला था.
Okay. Swallowing, SW will come. So Priyanka. Okay, so yeah, so even if you write small spelling mistakes, the basic English, if you make some spelling mistakes, yeah, they will definitely reduce scores. But for example, if you write, see here we had a, see for example, baclofen. Okay, now see over here the word baclofen, it is not an English word. Okay, it is basically a name of a medication. So here if you write some spelling mistakes and all, it is completely fine. So for example, instead of writing FEN, if you write FAN, not a big issue because it is not an English word and it is a brand name of a particular medication. Not a big issue. Orthopedic, okay, so we can write the British spelling or we can write the American spelling, it doesn't matter. Here also, it is not a very common English word. Here, if you make one or two spelling mistakes also, they will be little bit lenient. They will be still be giving you scores. Now, swallowing. Okay, swallowing is basically a very common English word. Okay, so here, if you do make a spelling mistake, definitely some reduction can be expected. Right. So like that, you have to perfect your anticipation skills. Okay, so over here it is not going to be a side effect because side effects included, and because of the side, as a result of the side effect, she had difficulty doing an activity. So the word activity is what we have to be look out for. Right. So in the audio script, maybe they will maybe say certain other things as well. So we should not be on the lookout for that. Is there anything else? It is medications. No, there is not much side effects here over here. Right. So this is what mainly we have to talk about. Okay. So we'll just use the last question over here, and then we'll have a small doctoral session. So let's read the 24th question over here. Analgesic relief, morphine, self-administered via dash. So who is administering the morphine over here? The patient herself is administering the morphine, right? And the word over there is via. That is how exactly, what is the route of administration? Okay, so that is what we need to find out. Yeah, route of administration. Okay, ROA. Right, so I'm going to play you the answer. The audio. Using what did the patient self-administer morphine? So that is what the question. So it is a drug delivery system. Okay, that is what we understand. So like this, you must be able to predict what the answer is even before the audio plays, so that it will be very easy for you to write down the answer. All right, so let's see what the answer is by listening to the audio.
Really made much difference. I just got more and more confused, and loss of memory became a problem too. Just for pain relief, they ended up giving me a pump so I could give myself morphine. Finally, I saw something in my ST support group's magazine about a relatively new type of surgery being done by a local neurologist, and that would be you. So, yeah, here I am.
And
all right. So the answer is going to be what? A pump. Okay. So via. Okay. So through what? How basically did the drug get delivered into her system? Okay. So here, if you want, you can write a pump also. Okay. So a pump or pump, both are actually accepted. So see, as you can see over here, the 24th question. And in the answer key, if you see some words inside, brackets, that does not mean you have to write in brackets. This is an optional word. Okay, so this is compulsory. The word pump is compulsory. You definitely have to write it. Loss of memory, you definitely have to write it. Oral medications, you definitely have to write it. It is compulsory words. But there are some words that you can write optionally. You see the word various. The various is optional. If you want, you can write. If you don't write, also not a big problem. If you write a pump, no problem. If you write only pump, it's problem. So the brackets are basically optional information, right? And the other words are basically compulsory information that you need to write. So listening part A is basically the easiest. Okay, so compared to B and C, listening part A is usually the easiest. And I'll tell you why listening part A is easy as well, because it is, fill in the blank questions. We can predict what the answer is, and the answer is going one after the other, right? And just one words, two words will be the maximum, the correct answers and all that. Okay, and we just have to be very attentive on one focus thing. Okay, but whereas in answer multiple choice questions, now see multiple choice questions, you have to keep answer option A in your mind, answer option B in your mind, answer option C in your mind. You also have to have the memory of the question. See, multiple information you have to register into your mind. Okay, and you have to practice eliminating the incorrect answer options. So compare to all this, answer listening part A, just one information, just only one information you have to keep in your mind. So there's a little bit more relaxation, right? And this is coming in the very beginning. Okay, the very first test that you do is basically the listening part A. So you have a lot of energy available. Okay, so that your brain is very fresh, your brain is not exhausted. Okay, so you have a lot more energy to tackle the exams, the questions. So that is definitely going to help you out over here. Now, there are certain things you need to know that listening is basically very interesting examination, but at the same time, it is a very volatile. Okay, volatile examination means things can go anytime, any unpredictable. That is basically it may go very good, or it may go very bad. Okay, it can be very much unpredictable. That's why it is called as a very volatile examination, right? So here I just want you to one information that I want to say is that the OET people, the way they design the question paper is not random. Okay, never think that everything is precisely calculated. Okay, there is a lot of calculation that goes into, the question paper making. Okay, the reason why 13th answer comes first, the reason why 14th answer comes second, 15th comes third. Okay, the reason why it comes in that particular order, it has been very, precisely calculated. It's not simple random information that is coming out. There's actually a lot of brilliance and a lot of effort goes into making one listening, reading, writing, or speaking question paper. Okay, because it is testing you on several skills over here. Now, for example, now let's say that this is 13th question, right? So maybe the 13th question and the 14th question will be very difficult questions. As I told you, you can expect very easy questions, you can expect very difficult questions, you can expect medium difficulty questions. Now the 13th and 14th question will be super difficult, and the 15th question and all will be little bit easy. So now if a student, as soon as they do the 13 and 14, they did their best performance, but they are not able to, register the correct answer. And if the student's confidence levels completely drops, okay, the confidence levels completely drops. Now what is going to happen? The student is going to doubt themselves. Okay, the student is going to blame themselves, right? And now they will not be able to think clearly. The thought clarity is gone. Okay, and even though the 15th question is very easy, they will not be able to write down the correct answer. So that is why I told you it has been calculated. Okay, they have deliberately designed it like this. It is not random. It may look random, but it is not. And on the other hand, it can be the other way around also. Maybe the 13th, 14th, and the 15th, and even the 16th question may be very easy questions. Okay, so now you're feeling very, very happy. 13, 14, 15, 16, you got completely correct. Now the 17th question may be a very tough question. Okay, so now your mind is telling you, I got 13, 14, 15, 16 correct. So definitely I will be able to get the 17th answer correct as well. So when the audio is in the 18th question, your mind will be in the 17th question. Okay, that is, they want you, the OET people, they want you to think about the 17th question when you are supposed to concentrate on the 18th question. So the student will think the previous questions I got correctly. So obviously the 17th question also I will get correctly. Okay, so let me just think. And instead of focusing on this question, they'll focus on this question. And what is going to happen? When the audio was playing, they did not find the answer to 17th question. So this answer is definitely wrong because they are not going to listen to the audio once again. So this is gone. This is completely gone. Now, what are they doing? They're sacrificing the 18th question. So instead of concentrating on the 18th question, they're focusing on the 17th question. Now, by default, they sacrifice the 18th question. Now, the 19th question also will go wrong because instead of focusing on the 19th question, they're trying to think about the 17th and the 18th question. There's a very strong temptation that happens. Now, what will happen? A chain reaction of tragedy happens. 17, 18, 19 is going wrong. Now the anxiety comes in, your tension, your stress, everything will come in. There is no more thought clarity. You cannot focus, you cannot concentrate, you cannot do the keyword analysis, you cannot predict. And now everything in one single stretch will go completely wrong. So this has happened to several students. And then listening part B, listening part C, reading, writing, and speaking, everything will be negatively impacted of just one single question in listening part A. Okay, so that is why you have to be very, very cautious and you have to be very vigilant as well when you're doing these type of questions. So if at all you do make a mistake, don't worry, just move on. Okay, just move on. Okay, just move on to the next question. You have 42 questions over there and just concentrate on the next question. And another thing I want to say is that when you get this 30 seconds time, okay, so remember I told you that you have to be a strategist over here. Okay, simply knowing English and simply knowing what to do and simply knowing the pattern is not enough. You need to have the right strategies with you. So the style in which you utilize the 30 seconds are very, very important. Now, what some students do is they will, simply read the 12 questions 2, 3, 4 times. Okay, that is, they will read, okay, has had over a long period, reports frequent in the last year, most recently has become a problem, word used to describe symptoms, frequent patient did initially link this to, works as an situation at work means. Now, like this, in this fast, okay, this quickly, they will read all the 12 questions. And once again, they will read the 12 questions. So they are just convincing themselves, oh, I got 30 seconds, and within 30 seconds, I have read all the questions 2 times or maybe even 3 times. Now, let me ask you, what memory is the student going to have? Just reading like that, what memory, what knowledge, what keywords got registered into the mind? Nothing got registered. So even though they spent a lot of time, even though they spent energy, okay, even though they tried their level best, it was not cleverly used. It is not going to help them when the audio is going to play. When the audio is going to play, these 30 seconds should give you a benefit. That is the main reason why they give you 30 seconds. Because when the audio plays, okay, if you have utilized the 30 seconds very properly, it will be a much easier experience for you. So instead of blindly reading it, instead of aimlessly reading it, read with intent, read with an aim, read with an idea to comprehend the question. Okay, so take your pencil and read very clearly. Okay, background has had over long period. Underline the linking words, underline the keywords. Second question, reports frequent in the last year. Okay, so last year the patient has been frequently reporting something. The patient works as an, situation at works means the patient is present tense, right? Now, has undergone something. So if you are putting in some extra effort, okay, if you're reading clearly and you're reading to understand, you're reading to comprehend the question, okay, just reading it one time is enough. And that one time, underline the keywords, circle the keywords, highlight the keywords and go. So at least when the audio is playing, you will have a memory of what you read. You will have a clear memory of what you read, and that memory will make it easier for you to predict the right answer. Okay, so don't foolishly, put yourself in stress. As I told you earlier, the OET is a very calculated exam. This is Cambridge University, 200, 300-year-old university over there. The people with English, PhDs in English literature. Now in India, it is very easy to get a PhD. You give some money to a fake university, you get a PhD within 2-3 months. But in Western countries, to get a PhD, you have to, work for several years, right? And these are the people who make these question papers. They have PhDs in English literature. Okay, so if they are not going to give you random 12 questions, it is going to be a very, calculated ordeal over there. So you have to never underestimate what you're dealing with, right? So you have to make sure that you're giving importance to reading the questions very properly. They're giving you 30 seconds. It has been given to you for a specific purpose, right? So like that, you have to read and you have to take yourself forward. Now, another thing I want to say regarding the benefit of reading with the 30 seconds very clearly is that, so remember when I told you, there will be very easy questions. Now, let's say that you got the first answer correct. Okay, you got the second answer correct, the third you got correct, the fourth you got correct, the fifth you got correct. So you're feeling very happy, right? Now the sixth answer over here, the sixth answer, maybe you were not able to catch it. Maybe the sixth answer over here, works as a dash. Okay, it was a little bit confusing. Maybe the audio was very fast. Okay, the audio was a little bit fast. Maybe the accent was difficult for you to understand. Okay, maybe it was an indirect question. As I told you, you can expect easy questions. You can expect very difficult questions as well. So the sixth question, even though you tried your best, but you were not able to understand what it is, or you didn't even realize. Sometimes this is also very common. You will not even realize the answer has gone by. Okay, you will not even realize the answer has gone by. Now the audio will be in the seventh question. The audio is now in the seventh question, but you are still waiting for the sixth answer. You think the answer to the sixth question has not yet come. So you're still in the sixth question, but the audio is now in the seventh question. Now the audio has gone to the eighth question, right? Now, if you have utilized the 30 seconds, okay, the 30 seconds, if you have utilized it very clearly, if you have utilized it very properly, your mind will tell you, okay, so when you hear these words, complaints, okay, or lack of, like this, sufficient, like, when you hear these type of words, your brain will remind you, I have read these keywords before. I have a memory of these keywords. So what you can do is that you can immediately, okay, you can understand, okay, I did a mistake. Okay, now the audio is no longer in the sixth question. Now the audio is in the ninth question. So what you can do, at least you can come directly from the sixth question to the ninth question, and you can try to get the answer to the ninth question. Because this is very, very common. You will not even realize the audio has gone by. You may be waiting for the answer, and then after a long time, you will realize the audio is now in the ninth question. Now, if a student who did not read the questions clearly, the 12 questions, the student did not give it much importance. The student was aimlessly and blindly reading it. They will never recognize. They will never recognize now the audio is in the ninth question because they don't have any memory of the keywords of the ninth question. Now, when the audio goes to the 11th question, okay, then they will understand, okay, so like that small benefit is also there. If at all you feel like the answer has gone by and now the audio is in the another question, at least since if you have done the 30 seconds, if you utilize the 30 seconds clearly, you will at least be able to jump to that specific question, at least get that one answer correct. Okay, so everything is very important. And again, nervousness, tiredness, and distraction. You should expect all these things. You will become nervous, you will become exhausted, and you will become distracted. But you must continuously interact with the question paper. All your strategies should help you to withstand exhaustion, to withstand tiredness, distractions, and nervousness. You must never allow these things to negatively impact you on your listening performance, right? So if you make a mistake, move on and utilize the 30 seconds and think very clearly, predict, anticipate, and all that. So all these recorded lectures are completely available in the app. Okay, so each and every question, I have clearly explained it with videos, animations, explanations, translations also. So if you have any doubts over there, you just log into the app and you just go through the recorded lecture, and there you can find the answers. And still, if you have any difficulties, you can just reach out to me through WhatsApp. I'll be getting back to you. Right, so today we discussed about listening part A.